welcome back to Healthy and Happy Living with Tiryak, your trusted source for expert insights, inspiring stories, and evidence-based advice to help you live your healthiest and happiest life. I am Dalia Gamil. Hopefully you can hear my smile. Today we're honored to welcome a distinguished guest whose expertise and contributions to the field of eye health have transformed countless lives, Professor Dr. Hani Sakla. Professor Dr. Sakla is a consultant ophthalmologist, the founder and director of Ebsaar Eye Surgery Center and the Spanish Eye Clinic in Dubai, and the former head of the Cataract, Cornea, and Refractive Surgery Unit at the Dubai Health Authority. He also serves as Professor of Ophthalmology at Dubai Medical College, where he continues to shape the next generation of eye care professionals. With decades of clinical, surgical, and academic experience, Professor Dr. Sakla is leading voice in ophthalmology, particularly in the areas of cataract, corneal diseases, and refractive surgery. In today's episode, we'll delve into how eye health is deeply connected to your overall well-being, explore common vision problems, and discuss the latest advancements in eye care and treatment. Stay tuned for an enlightening conversation that could quite literally change the way you see the world. Let's begin. Welcome, Dr. Sakla.
Thank you for having me.
Dr. Hani, we need to start with the early signs of eye issues that people tend to ignore.
Usually, there are so many symptoms that should push the patient to visit his ophthalmologist. Of course, drop of vision. If the patient sees less than what he used to see, this is, of course, the most important symptom related to the eye. Other important symptoms: pain inside the eye, redness, watering, severe headache, and abnormal appearance. Abnormal appearance, by that we mean that there is something that was not there and appeared in the lid on the surface of the eye, or the eyes used to be straight. Now one of them is convergent or divergent, looking inwards or looking outwards. One more symptom which is important is the sudden development of double image or diplopia. These are the main symptoms that if any patient started to suffer from any of these symptoms, should go to his ophthalmologist.
That's many, and we are encountering day to day sometimes. And what are the most habits people can adopt to maintain good eye health as they age?
Actually, of course, thing that we should avoid is exposure to the sun without protection, like without the use of proper sunglasses. We should avoid rubbing the eyes. This can weaken the cornea and cause decrease in the visual acuity. Other things, the quality of life these days are compromising the health of the eyes. The long working hours in front of the screens can cause dryness with its symptoms of burning, itching, redness, watering, photophobia, pain on exposure to the light, headache, sometimes discharge also.
Actually, yes, the digital age is having a toll on our eyes, and we need to keep up to it and get checked every now and then to make sure that our eyes are staying healthy all along the way. Dr. Hani, can nutrition and hydration really improve and protect vision?
Yes, indeed. Good quality food, balanced diet can help protect the retina and the surface of the eye. Food that contains vitamins like vitamin A, vitamin C are crucial to the health of the eye. Food supplements that contain lutein, zeaxanthin, certain types of omega-3, omega-6 are also very important to the eyes. And these are included in the fish and in the dried fruits, nuts, and in many other food elements.
And when we should consider cataract surgery or refractive procedures like LASIK?
Cataract surgery is one thing, refractive surgery is another thing.
Okay.
Cataract surgery, this is a medical necessity First, I want to say that age, of course, is the main cause of developing cataract. But cataract can happen at any age. There is congenital cataract, newly born children with cataract that we have to operate them in the first week of their lives. Drug-induced cataracts, patients on steroids systemically or even nasal spray can develop cataract at an early age. Complicated cataract secondary to eye disease, like inflammation in the iris or any intraocular inflammation, can cause complicated secondary cataract. A very common cause also of cataract is systemic diseases. The most important is the diabetes mellitus that can cause cataract in very early age, depending on the type of diabetes. If type 1, we can see cataract as early as the early 20s. In type 2 cataract, we can see early cataract in the early 50s. So cataract, the main symptom of cataract is the drop of vision, or sometimes they see in the day less than what they used to see, or other type of cataract, they make them have poor night vision, or double images in one eye, or foggy vision. These are the symptoms, and of course, during the examination, we discover the presence of cataract, which is by definition the loss of transparency of the crystalline lens inside the eye, which is a very transparent organ. Any loss of the clarity of this is defined as a cataract. When is the time to do the cataract? We do the cataract when the patient is complaining of visual symptoms. He is not happy with his vision. Or if the cataract is precipitating to something more sinister, like acute increase in the eye pressure, what we call acute angle closure glaucoma. In that case, we have to do it as early as possible. Other than that, we do it usually depending on the patient's symptoms. If he is managing well in his life, then we can follow him up and wait. Of course, if it is affecting his work, his reading, his driving, then we should do it as early as possible.
Very wide and insightful, though. And how about LASIK?
Yeah, LASIK is under the group of laser vision correction techniques. We have so many techniques. The purpose of the LASIK is to make someone who's using glasses to see without glasses. Exactly the way that he sees with glasses or contact lenses, but without glasses. So his eyes should be normal, and the only objective is to make him glasses independent. Laser vision correction includes laser surface ablation, what we call photorefractive keratectomy or PRK, include the LASIK with all its subgroups like femto LASIK using the femtosecond laser, or using the mechanical microkeratome, the opti LASIK, or the intra LASIK, or the ultra LASIK. So many names for the LASIK, but they all entail the same technique, except the femto LASIK, which includes the use of femtosecond laser in it. Then we have the SMILE technique, or the lenticule extraction, also to correct the vision. These are the laser vision correction. Sometimes the patients might have very high refractive error, very high myopia, very high astigmatism, and the eye is not suitable to correct this with laser technology. Then we resort to implanting lenses inside the eye in the presence of the actual normal lens inside the eye. On top of the normal lens, we implant another lens. We call it ICL, or implantable columnar lens. this can correct any degree of refractive error, any degree of myopia up to -20, astigmatism up to -9 in certain types of implantable lenses, hyperopia, mixed astigmatism, in normal eye, in operated eye before because of keratoconus or because of after keratoplasty operations. So in cases that we cannot correct with laser, we can do ICL, implantable coronal lens.
That's awesome.
Yeah, there's so many options.
Great to have too many options. And what misconceptions do people have about eye surgeries?
Many actually. Some they believe it could be painful. It is not at all. We cannot do anything in the eye in the presence of pain. That is almost impossible. So with the use of topical anesthesia in the form of eye drops, the patient is pain-free totally. This is their main worries, the pain during surgery. Other worries is that they think that from maybe negative experience in their peers, neighbors, friends, they wait for so long, especially I see this in patients with complications of diabetes mellitus. So they listen to negative experiences from people who had also waited for so long, and they have at the end a negative outcome, and this impacted their decision to start the treatment. And they wait for a long time till it is really sometimes beyond repair or inoperable or too late to correct any or to save any vision left. So they should be positive. They should listen to their trusted doctors. They should think of this as case by case, not as this disease is blinding disease or this treatment is blinding treatment. There is no such a thing. Every disease nowadays have very, very advanced treatment. We have so many new drugs available to recover the visions after it has been lost. So this is the second thing that I would think.
Yeah, so getting treatment the earliest is the best. And we are grateful very much for the research and development that get us all those options for treatment.
Exactly.
Dr. Hani, how has technology improved the safety and effectiveness of these surgeries?
Actually, ophthalmology is one of the most advanced branches in medicine in general. The developments that happened in the field of ophthalmology is amazing, is great, made the difference between the light and the darkness, between the day and the night. I started ophthalmology now, maybe in the year 89, so I don't know how many years now, 36, something like that. And most of the things that we treat now very safely, very effectively, had no treatment then, or very little and less effective treatment, or not the recovery was so fast like now, or the procedure was so complicated. Now it is very simple. That includes the cataract surgery, which developed a lot from my days early on, when we used to do the cataract without implanting even lenses inside the eye. It was only removing the cataract and leaving the eye without a lens, with all the complications that was related to this type of surgery, which we used to call it intracapsular cataract surgery. the patient had to use very thick glasses. He actually, after this kind of surgery, could have been considered as disabled person in a way, because his visual field with his glasses was very limited. He could not drive as he used to do. He could not read as he used to do. So cataract now is very fast procedure in few minutes. The technology in the lenses that we put inside the eye can correct anything from myopia, from astigmatism, from presbyopia even, which is the loss of reading vision at the old age. All this can be corrected. As I said, the operation takes a few minutes and the recovery a few hours, and the patient returned to his normal life from the very first day. And it is very safe, the risk of complications is not what it used to be in the past. So cataract surgery is one of the things that I believe have developed the most in all the fields in medicine, because there is no surgery that I know about that can lead to full recovery in few hours, and it takes a few minutes. There is no such a thing in any other branch in medicine.
That's real.
Yeah, in orthopedic, cardiology, kidney, brain, there is no such a thing. The other things that we have witnessed the development and its impact on the life of the patients is the use of what we call anti-VEGF drugs to treat the complications of diabetes on the retina. We used to know that diabetes is the main cause of blindness.
Yeah.
So now this is not the case, because the anti-VEGF, which are drugs that we inject inside the eye, can treat the complications of diabetes inside the eye, like the macular edema, the swelling inside the center of the vision, or the new abnormal vessels that can lead to massive hemorrhage inside the eye, by simple injection, not painful at all, also under topical anesthesia. This can recover the vision and save the vision and keep the vision. The other advancement that I have to mention is of course, the field of refractive surgery, or the vision correction in general. This field was born in the early 90s, so now it's maybe 34 years since the first LASIK, and it is now the most common operation practiced worldwide after delivery.
Oh.
So millions of patients undergo this surgery every year around the globe. The last thing is the treatment of keratoconus, which is a disease that affects the cornea and leads to loss of vision because of the development of irregular astigmatism. Regular astigmatism is astigmatism that we cannot correct with glasses. We can correct only with hard contact lenses or with laser vision correction. Keratoconus now, in the past maybe 15 to 20 years, the diagnostic tools that we have are very helpful to us. We can diagnose the disease even before it starts to give symptoms, and this is very important, because once the disease starts to give symptoms, the options for treatment is less. So now we can diagnose the treatment even before the patient is aware of it, using tools known as the tomography, corneal tomography, with the pentacam or with other machines. Then after we diagnose this, we have also in the past 20 years, which evolved a lot recently, is the treatment of keratoconus to stabilize the and to freeze the disease in order not to progress. This treatment is known as corneal collagen cross-linking. Then also the excimer laser is used to recover the original shape of the cornea by a topography guided treatment. We take the map of the cornea, which is abnormal in keratoconus patient, and we put it in a laser machine, and the laser machine will make the irregular shape regular, so the patient can use glasses again to be able to see with the glasses, or we can do other steps for him to become glasses independent.
This seems like it was beyond the dream for some people
Yeah,
earlier to us.
of course, yeah.
And do you have certain eye care tips for different age groups like kids, adults, seniors?
Very important for the kids. Parents, they should check the vision of their kids before the school age, uh, because any vision problem that is discovered early at the age of 4 or 5 can be corrected 100% and treated. But if it was neglected and discovered later, after the age of 9, 10, then the recovery of the vision sometimes is impossible. And this is what we call lazy eye or amblyopia. So every family should check the vision of their children before they go to the school. Yeah, seniors, they should check their eye pressure at least once after the age of, not very seniors, mid-age, after the age of 40, when they start to need glasses for reading, they should check their eye pressure, their nerve, to make sure that they are not at risk of developing glaucoma or high eye pressure,
Yeah.
because glaucoma is without any symptoms.
Yeah.
So, because it has no symptoms, the patient may present very late, when it is really late, when there is nothing that can be done for him. In glaucoma patient, it is better to identify it, to discover it, to recognize it, to treat it, then the patient will keep his vision. We know that 2% of the population above the age of 40, they have glaucoma. So this is not a rare disease, it's a very common disease, and it has to be discovered in the right time to be treated again in the right time.
So here is the recommendation. As we have our annual checkup, we have to check our eyes within our annual checkup as well.
Absolutely.
Are there different concerns for men and women when it comes to eye health?
Yeah, there is one thing that I always keep saying, and I repeat and I warn from, which is the careless use of contact lenses. This is very serious. It leads to devastating eye complications like infected corneal ulcers, like the growth of vessels inside the cornea, like the reduced corneal sensation, like the severe dryness, severe allergy. So contact lenses, nowadays, I don't see why a person can use contact lenses unless in very, very few and limited indications that we can need contact lens use. Other than that, there are so many options, safe, and it can protect his eye from the complications of contact lenses at the long term. Or those who insist to use contact lenses, they are afraid from surgery. They should take very good care of their contact lenses. They should not sleep with their contact lenses. They should not swim with their contact lenses. Um, they should use the daily disposable type of contact lenses in order to make sure that the storage of the contact lenses is not contaminated.
True. So our eyes need to breathe.
Yeah.
This is very simple words, in
Exactly.
very simple words. Dr. Hani, how has the UAE evolved in terms of eye care awareness and across over the years?
UAE came a very long way. It's a huge success story, not only in ophthalmology, in all fields of medicine. Now, practice of medicine is considered to be the state of the art. The latest technology is always available in UAE before so many other uh, countries that some of them we might call even advanced countries and developed countries. All medicines are available from the West, from the East, from Europe. Some of the medicine maybe you see it available in Europe, not in the US. You will find it available here, and the opposite is true. Available in the US, not available in Europe. Available here. Um, the access to care is considered to be one of the best in the world. The insurance system is very reasonable, um, and the staff, medical staff, nursing staff, are considered to be the best actually.
Very true.
Yeah, and we have here the best calibers coming from all over the world, from the US, from Europe, from Asia. So I see the landscape in the sector of medicine in the UAE very promising, very good. I see people coming to seek healthcare in UAE, which is something that was not there maybe 10 years ago, 15 years ago. Now also, you see that in the beginning when I came here 26 years ago, patients used to insist to travel to have treatment abroad. This is now very rare. We don't see any patient who wants to go to have treatment like they used to go to UK or even India or Russia or Germany or everybody is satisfied with the care that they get here, and they are convinced even now when they travel, some of them, and they compare, they come back convinced that here is the best place to get medical treatment and procedures.
That's very true. And the best is the access. Like, no one is
Yeah,
waiting more than
yeah,
couple of days to see his doctor. That's at most.
exactly. Yeah.
Professor Dr. Hani Sakla, what inspired you to found Ebsaar Eye Surgery Center and Spanish Eye Clinic?
Well, I came to Dubai. I was working as consultant ophthalmologist in at that time Department of Health and the Medical Services that then became the Dubai Health Authority, and now it is Dubai Health. I'm still there. Um, so I was very satisfied and happy with my practice. But you know, as a physician, one always aspires to have his own practice, his own patients, his you know, to be able to build a dream in his mind and a concept and a setup that he feels very comfortable and he can practice the things that he likes the way that he likes. So we opened Ebsaar Eye Surgery Center in 2009. And then after 10 years later, we opened another branch in Sheikh Zayed Road, which is the Professor Sakla Spanish Eye Clinic. There, because you know Dubai is expanding. Dubai, the traffic is busy now for the people to travel from one neighborhood to the other. Sometimes is challenging. So we try to reach out for our clientele from the side of Abu Dhabi, Barsha, Suqim area, And here in Jumeirah, our Ebsaar center, nearer to Jumeirah area, to Deira, to Sharjah, to Northern Emirates.
Very inspiring, and again enforcing the access message. So you are giving your patients the easy access chance. And what are some of the proudest moments in your medical career?
No, actually, every day I'm very proud of every day. Always seeing a patient the next day with good vision after a surgery makes any surgeon very proud and very happy. And for me, maybe these are the only things that can make me happy and forget any hard times, any hardship, any bad mood. Once you see the outcome and you see a happy patient, then you become very proud and very happy.
Excellent. Dr. Hani, what are the most exciting advancements in eye surgery or eye care in recent years?
This we have mentioned the developments
Okay.
in the cataract, the refractive, the cornea, and also in corneal surgery. Now we do it under local anesthesia, the corneal transplant, which is a very, very big step to do it using the the femtosecond laser to cut the cornea in the donor tissue and in the patient, and to suture it with one stitch only. This is a very big development in the surgery of organ transplant in general. Also, in the corneal surgery, the recent development is that we don't do full transplant, or what we call full thickness cornea. We only transplant the diseased tissue. If the diseased tissue is the innermost layer of the cornea, the endothelium, then we replace this layer only, and very fast. Instead of replacing the whole cornea, we replace only the innermost layer, and the patient recovers his vision very quickly, not like in the past. Also, in lamellar corneal grafts, we don't have to remove the whole cornea and put another cornea. We remove the diseased superficial layers, and we put another clear, transparent tissues that we get from the eye bank in USA. And the rate of rejection in these patients is much less than before, because in any organ transplant the main challenge is the rejection. So with the new techniques, rejection is much less than before.
Having said that, are we close to reversing or significantly slowing vision loss in aging populations and general population?
The main cause of vision loss in Asian population was a disease known as AMD, age-related macular degeneration. And there are drugs now available, but the patient, they might have to use it. It's injection, again, inside the eye. The patient, before they used to lose their central vision without anything to stop this from happening. Now is this injection, but they have to use it at certain interval every few months for the rest of their lives to keep their vision. So the main reason for vision loss in old age is the AMD, and now has treatment. This is related to the loss of vision in old age, but loss of vision in other ages, many we can treat, except yet the hereditary congenital dystrophies in the retina or in the optic nerve. But we see gene therapy coming, started to treat some of these congenital hereditary diseases. Unfortunately, at this point in time, it is considered to be very expensive, but the government, they finances the treatment. I hope that in the future we see more gene therapies for other hereditary diseases.
Looking forward to it. Dr. Hani, please share with us your insights from teaching at Dubai Medical College.
Yeah, of course, teaching is something that I considered sacred to convey the experience, the knowledge that we have to the next generations. And it is very enjoyable. And you don't only teach, you also learn from your students. You meet students who are very smart. They are, sometimes we ask them to present a topic. And I don't remember a time that I have attended one of those presentations without learning something new from the students. Medicine is very, very long career. It requires a certain characters. So doctors are very special in their perseverance, in their pursuit of excellence, in their compassion, in their so many things. So being among the future doctors is always rewarding.
Very glad to hear this. I feel like you're taking medicine as a mission.
Of course, yeah.
And what qualities would you advise your students to become great ophthalmologists one day?
The problem is that access to become an ophthalmologist these days is very, very difficult because it is in demand and there is a lot of competition worldwide. But at the end, those who insist, they will find a way to become an ophthalmologist, but it's a very long way. They have to remember that all the time. It's at least to become reliable ophthalmologist and ophthalmic surgeon, you need, after graduation from the School of Medicine, you need at least 8 years.
That's a long way, and they have to be very patient.
Yeah.
Dr. Hani, would you like to give us some personal information about yourself, like your morning routine and what's one thing you daily do for your own health?
There is one thing that I always do every morning, which is having my cup of coffee. This, I can never start my day without my cup of coffee, no matter what. So wherever I am, I have to start my day with the cup of coffee. Unfortunately, I cannot claim that I'm a very healthy person myself. I eat whatever I want. I'm lucky that I don't gain weight.
That's awesome.
Yeah. But I always believe in moderation in anything is key for good health and for to stay away from the doctors.
Thank you. And actually, today I feel like Dr. Hani Sakla offered us an ocean of knowledge, and if we have asked many questions, we would have get to know more and more information. He's like guru in ophthalmology, and that brings us to the end of another enlightening episode of Healthy and Happy Living with Tiryaq. A heartfelt thank you to our esteemed guest, Professor Dr. Hani Sakla, consultant ophthalmologist, professor, and visionary founder of Ebsaar Eye Surgery Center and Spanish Eye Clinic in Dubai. Your insights into eye health, modern surgical innovations, and patient centered care have truly opened our eyes to what's possible in ophthalmology today. To our listeners, thank you for joining us. If you found this episode valuable, be sure to subscribe, leave a review, and share it with someone who cares about living a healthier, happier life. Until next time, stay well, stay curious, and keep your vision and your life clear and focused. And take joy wherever you go. Thank you, Dr. Sakla.
Thank you very much, and thank you for your very good questions.
Thank you.